Welcome to Easy Ayurveda Gurukula, a proud presentation of easyayurveda.com. Dr. Bhavya, third PG scholar, Shalakya Tantra Department from Sri Vijay Mantesh Ayurveda Medical College, Shilpal, Bagalkot district. Again, she has gained a rank in her post-graduation examination. Lot of felicitation to her names, met many stalwarts, paper presentations, attended seminars, conferences, presented many papers, participated in many activities like health surveys and health camps. There you see 8 paper presentations, 1 international, 2 national, and 5 at state level, postal presentation to add to, and has given some speeches too, have got recognitions and also some prizes, ranks. We'll continue the topic, utility of Netra Kriyakalpas in prevention and cure of eye disorders. So this will be the part 2 after Dr. Bhavya having presented on Anjana, so in the previous episode. So today she'll be touching upon Netra Tarpanam and its clinical utility.
I welcome all of you for today's session, that is Netra Tarpana. Let us start with my session. Netra Tarpana, it is one among Netra Kriyakalpas. Coming to the introduction, it is one among Netra Kriyakalpas, and Tarpana Kriya is mainly Brahmana in nature. That is going to give an effect such as nourishment mode, and it is also called as Netra Basti or Akshi Tarpana. Netra refers to eyes and Basti stands for to hold. That means compartments which is holding the medicines or retaining something inside it. Mainly medicated ghee is used in this condition. So for this procedure, they have mentioned it as Netra Tarpana in our ancient science of Ayurveda. Why we have to plan for this Netra Tarpana? I have mentioned that nowadays there are so many children are using the spectacles. So for that reason, coming to the Mahatva, Netra Roga Parimarjanartham. Netra Roga Parimarjanartham, that means it is going to prevent the diseases which are affecting the eyes, and Drushti Prabalatvam. It will increase the vision, and Drushti Prasadanatvam. It will nourish the eye, and Drushti Vardhanam. It will reduce the power of the spectacles which are using nowadays by the children and all. In Netra Tarpana, in which and all conditions Yogya means who are fit for this Tarpana. That is blurred vision, darkness in front of eyes, dryness of eyes, falling of eyelashes, burning eyes, as well as tired or aching eyes, who spend a lot of time in front of computers and who wears the spectacles. That is, they have mentioned, we'll diagnose it as myopia, hypermetropia, and astigmatism. So these are the persons, they are fit for the Tarpana, and normally we can take as a Swastha also we can take this Netra Tarpana to further nourishing of eye. Some more conditions like roughness of eyes, stiffness of eyelids, falling of eyelashes, dirtiness of eyes, deviated eyeball or squint eye, or in case of any injury or traumatic conditions of eye also we will refer this Netra Tarpana, and Vata and Pitta predominant disorders. Coming to the Tarpana Ayogyas, for whom we should not give this Tarpana. That is, according to Acharya Shishita, he mentions Tarpana is not indicated in such a conditions like when on a cloudy day, that means when the weather atmosphere is full of clouds, that condition we should not prefer this Tarpana. And extreme hot or cold seasons also, and in conditions of worries and anxiety. When the patient is in worry, in that case also you should not go for this Tarpana. And in conditions of giddiness of eyes, in complications of eyes, in the conditions of acute pain, patient is telling that he is having a painful eye and along with inflammation, and you are seeing a redness from the patient's eye. In such a conditions, we should not prefer this Tarpana. So we have planned how we have, for which patient we should plan for Netra Tarpana and which should not prefer the Tarpana. Though so we selected the Tarpana Yogya Rogi. In that conditions, we should plan every procedures. We know that it is having its Purva Karma, Pradhana Karma and Paschat Karma. And coming to the Purva Karma, that is pre-operative, what we have to make appropriate Shodhana Karma is carried out according to the Roga and Rogi Prakriti. So Shodhana should be done according to the condition of the Roga and the Rogi. Next, Sambara Sangraha. Sambara Sangraha means what are the ingredients are required for the procedure. In that conditions, we have to prepare all those ingredients and all. Rogi Manasthairya. Rogi Manasthairya means we should explain how the well, first we have to plan that whether the patient is fit for this procedure and is Satvika Bala also. Whether is Sattva Bala is Pravara, Madhyama, Ravara. Everything we should see and plan for this procedure. And Tarpana Vidhi should be explained for a patient briefly. So, Tarpana, how we are going to give the procedure and what is the procedure, so that everything should be explained for a patient. Because if we got to know the procedures in detail, what are the ingredients we are using and how the procedure is going to affect for a patient, then only they will come for us to take this treatment. Then Sthanika Abhyanga and Mrudu Svedana is done. So the patient is already so is fit for that procedure means we should go do this Sthanika Abhyanga and Mrudu Svedana over the eyelids. And Upadrava Chikitsa. While doing the procedure, if any Upadravas arises means for that also we should keep the Samagri Sangraha. What are the needed things are there for that. Then Tarpana Vidhi, cost and duration of this Vidhi. So we should explain the patient that how much cost this procedure is going to take and how many days we have to do this procedure and all. We should explain neatly to a patient. So these are the main Purva Karma, Bishak, Dravyani, Upasthata, Rogi Pada, Chatushtayam. So Bishak means here is the Vaidya. Then Dravya means what is the procedure, Dravyas which are required to do this Vidhi and all. Upasthata means one who is helping during the procedure, and Rogi. Rogi is nothing but a patient. So these all four factors should be necessary to do this procedure. Coming to the Pradhana Karma. Pradhana name itself indicates that Pradhana, what we are doing mainly to a patient. Netra Tarpana should be carried out in the forenoon or in the afternoon on an auspicious day. So it should not be carried in the early morning, and after the food are taken by the patient has to be digested. So we should tell the patient whether he has taken the food, whether it is digested or not. We should ask everything to a patient. If he feels whether he feels hunger or the previous food, whether he feels that it is digested or not. Like that, we have to examine. Then patient is made to lay in a supine position in a good lighted, ventilated room, that which is free from dust and smoke. So these things needed to do this Pradhana Karma. And so this is the procedure which we are doing. Next I will explain. Eyes are encircled with a firm, compact, leak-proof pali. That means wall which is made up of paste of powdered masha. By using the masha floor, we have to construct like this a floor around the eye. So it should not be in touch with the eyelids. So there is a gap should be there in between eyelids. Then according to the Vagbata, Pali is made up to height of 2 angula. What he mentions, Acharya Vagbata, that should be. So this, what is this Pali? It is, I have constructed, this should be of an height of 2 angular length should be there. And the patient is asked to close the eyes. So before the pouring the Gritha, so we should tell the patient, first we have to construct this pali which by using the masha flow. At that time we should tell the patient to close the eyes. Next, over the closed eyes, Gritha processed with appropriate drugs and liquefied in lukewarm water should be poured on the orbit. So next what we have to do means the Gritha which is suitable for a patient condition as well as the Vadi. So for that selected Gritha should be poured in the condition as lukewarm state. So till the level of tip of eyelashes immersion, that means apakshmagra tata syat. That means up to the immersion of these eyelashes. See in this the picture is showing that patient eyelashes should be immersed completely. The immersion of the eyelashes should be there. Up to that level we should pour the Gritha. Then the patient is asked to close the eyes. Then what we have to tell the patient to close the eyes. After this, over the closed eyes, Gritha processed with appropriate drugs and liquefied in lukewarm should be what we are pouring afterwards. We have to tell the patients to blink the eyes. Patient is asked to open and close the eyelids intermittently and steadily. Then we should tell the patient close and open the eyelids. Because when the patient is kept to closing means the medicine we should not enter into the inner surface. That means what is the tear film is there afterwards, sclera, cornea, up to the retina, it has to be reached. For that reason, we should tell the patient to steadily and slowly close and open the eyelids. So this is the procedure. Though after the procedure, I will explain how many times and what condition, for what prakriti, how many durations we have to repeat this procedure. Coming to the Paschat Karma, so this is the procedure. Up to this, what I have mentioned is procedure. And coming to the Paschat means after post-operative. After retaining of Gritha for a stipulated period of time, the Gritha is drained out through a hole which is made at the bottom of the duff wall near the outer canthus of the eyeball. So here in this picture, here this is inner canthus and this is outer canthus. So we are in this area, we have to make on a small hole. So by opening that hole, the Gritha automatically comes in the downward. So for that reason, we have to make a hole in that area. Okay, next, eye is irrigated with the lukewarm water fermentation. What we have to do means after removal of the ghee, which is inside, we kept, then we have to remove that poly which we have constructed around the eyelids. That should be removed. And after that, all this removal of these things, eye should be irrigated with lukewarm water fermentation. Should be done to a patient. Then the kapha which has already been stimulated. So patient was there in supine position. After this, we have to tell the patient to sit in sitting position. Then kapha which has already been stimulated by the potency of Gritha should be eliminated by the Shirovirechana. So what we did, Gritha. That is Vata Pitta Anilahara. Grutam Pitta Anilaharam. It will reduce the Pitta as well as the Vata. So automatically there will be some of the kapha which will be stimulated. To stimulate that kapha, to remove that kapha, we have to plan for Nasya. That means Shirovirechana Nasya. And then Dhumapana with the kapha suppressive drugs also. But in practically we are doing after the Tarpana, we are preferring the Dhumapana to removal of that kapha. Patient is then instructed to keep away from the exposure to bright lights, wind, sky, mirrors and luminous bodies. That means after this procedure, immediately patient should not exposure to these things. So because of this, patient have taken the medicine. If she is directly exposing to the bright light, the medicines won't act. Means that doesn't give the best result for a patient. So here explains Sneha Dharana Kala. Means I have mentioned that Gritha should be poured inside the eyelids. How many durations Sneha is Gritha? Dharana Kala means how much duration we should keep that Gritha. It should be the acharas have mentioned according to dosha prakopa. See here the dosha beda. If the swastha netra, if the person is he didn't have any diseases, for that condition acharas have mentioned 500 matra kala. And Ashtanga Hridaya Acharya Vagbhata mentions 500 Matra Kala and Sharangadhara 500 and Bhava Prakasha mentions 500 Matra Kala. And coming to the Vata Pradhana, if the patient is predominance of Vata Prakriti as well as is having in Vata Ata Vartma, like that Vataja Rogas, in that conditions, we have to pour the medicine and it should be kept over the eyelids up to 1000 Matra Kala. They have mentioned, all the Acharyas have given similar reference. And for Pitta Pradhana, they mentions 800 Matra Kala by Shushruta and for Vagbhata by 600 Matra Kala. Here Sharangadhara doesn't give any reference for this Pitta Pradhana and Bhava Prakasha mentions 600 Matra Kala. And for Kapha Pradhana, see the patient if he is having Balasa Gratita, like that Kaphaja Vyadhi, in that condition we should prefer to the patient such as 600 Matra Kala duration, we should keep that Gritha. The warmness of the medicine, that means we should immediately, if it is becomes cold, means we should make it lukewarm. Again we have to pour over the eyelids, and while pouring completely we should not remove that Gritha which we are poured inside. If you are removing completely means it won't result good. So for that reason, at least for the contact purpose, some of the Gritha should be kept contact with the eyelids. And for Ashtanga Hridaya, he explains for Kapha Pradhana 500, Sharangadhara similar, and Bhav Prakash also mentions similar, that is 500 Matra Kala. Sneha Dharana Kala according to Roga Adhishtana. So Adhishtana Veda, we know that Netra Bhagas, that is Sandhi, Vartma, Pakshma, Shukla, Krishna, Drushti, Sarva. Coming to the Sandhigata, there we know that Karinika Sandhi and Apanga Sandhi, two Sandhis are there. We'll show in this picture. See, this one is here the medial canthus is the Karinika Sandhi and lateral canthus is an Apanga Sandhi. And what we are seeing is Pakshma. That means eyelashes, we called it as Pakshma. And for eyelids, we mentioned it as Vartma. And for this black portion that we are seeing in this picture, that is cornea, we mentioned it as Krishna Mandala. And the white color part, that is sclera, we called it as Shukla Mandala. So next is the drushti, that is pupil. We mention it as drushti mandala. So if the disease is related with sandhigata, if the patient is having any sandhigata vadis, that is puyalasasa upanaha, srava parvanika allergy, krimigrantischa vigneya, roga sandhigata nava. Acharya Shushta mentioned 9 diseases for sandhigata roga. If the patient is having such a conditions, so we have to plan, and the duration of the Sneha Kala should be of 300 Matra Kala, and Ashtarya similar as per Vagbata and Sharangadhara, Bhavaprakasha, they all give, that is 500 Matra Kala, and this one is 500 Matra Kala. And coming to the Vartmagata, the disease related with eyelid. For that 100 Matra Kala, we have to retain the Gritha. And for Shukla Gata, as for Vartma Gata, example Sutsanginyata Kumbhika, Potaki, Vartma Sharkara. So these are the Vartma Gata Rogas. There are 21 in number. They have mentioned in our Sushruta Samhita, Uttara Tantra. And Shukla Gata Rogas are there. In that conditions, we should prefer like this: 500 Matra Kala Sushruta gives, and 500 Matra Kala Ashtara Vagbata gives, and 600 Matra Kala as per Sharangadhara. And Bhava Prakasha doesn't give a reference for Shukla Gata Roga. And coming to the Krishna Gata Rogas, they have Saurana Shukla, corneal ulcer, they have mentioned. For in that condition, we should pour the Gritha up to 700 Matra Kala. And Drishti Gata Rogas, that means Pratama Patala, Tritya Chaturtha Gata Patala. So that Patala Gata Rogas, we have to pour the Dravya up to the duration of 800 Matra Kala. And Sarvagata, if the disease is Sarvagata, means inside every parts of the highball is inside, means Shushkakshipaka. In such conditions, we have to plan the Sneha Dharana Kala should be of 1000 Matra Kala. See, we have planned and we have did the procedure according to the condition. Think that how this procedure is going to act. Coming to the mode of action, transient local vasodilatation of conjunctival vasculature by Sthanika Mrudu Sveda and Sukoshna Gritha. What we are doing in the pre-operative, that is Sthanika Mrudu Sveda as well as Sthanika Abhyanga, so that the conjunctiva which is going to become contact with this dravya, that is bulbar conjunctiva, so there will be local vasodilatations by this application of this Abhyanga. And then next layer is epithelium, cornea, that is having the 5 layers. First layer is an epithelium, that is endothelium of cornea, which is lipophilic in nature. We know that Gritha is a lipophilic which can penetrate the lipid layer. So for that they mention it as lipophilic. So this Gritha directly enters into the cornea. Enhanced absorption of drugs in the deeper absorption through the cornea irrespective of the layers, molecular size. So absorption of these drugs will be deeper. So they have mentioned irrespective of layers, molecular size. The molecular size, if it is of smaller or bigger, doesn't matter, the medicine will penetrate. Intraocular drug absorption of anterior to the anterior lens capsule. Next, which part is going to come after the cornea? Lens, that is anterior lens capsule. So for that, lens holding muscles are there, that is ciliary muscles, cornea and other tissues. So all these tissues will get the absorption through this ghee and desired therapeutic action relief in symptoms. So for this action, how it is absorbed means by step. First is eyelashes is going to exposure. So we know that eyelashes are a dead tissues. Hairs and nails are dead tissues from our body. After that, what we are going to feel, that is conjunctiva, bulbar conjunctiva, cornea, corneal layer, epithelium, stroma, Bowman's ciliary membrane, and prayer next lens. Lens is anterior capsular lens and ciliary muscles. So all these tissues are going to get a disease. Especially this Tarpana is mainly for the disease related to the anterior segment. It is going to give a good result. So we have did the procedure, and we know that in our Ayurveda, Patye sati gadarthasyam kim aushadha nishevanam. Patya asati gadarthasyam kim aushadha nishevanam. One who follows the Patya doesn't need the medicine. One who does not follow the Patya also does not need any medicines. For that reason, we should explain in detail for a patient after this procedure what is the Patya the patient has to do and don'ts, what should not be done by the patient. So coming to the Patya, Lagu Bhojana, we have to explain the patient to take the Lagu Bhojana and Shashtika Shali, Mudka, Saindava Lavana, Hamalaki, Yava, Antariksha Jala, Paya and Sarpi. So all these things are the Patya for a patient. We should advise according to the Agni of the patient. Apatya. So what are the things should not be done by the patient? See, Samanya Nidana Sevana. What he have did? What is the we know that as per Ayurveda, Nidana Parivarjana is the first line of treatment for every disease. So Samanya Nidana Sevana. What he is consuming or in his Ahara Vihara should be avoided. And Diva Subna should not go for day sleep. And Ratri Jagarana, waking at night, should not be done by a patient. Ati Sanni Karshat. And one patient who looks an object at Ati Sanni Karsha, very near, and Ati Viprakarsha. So like this, the patient should not gaze a object from a distance or near for more than 10 minutes. And Netra Roga Nidanas, they have mentioned Ushna Bitaptasya Jalapraveshas. So all these things, etc. So many Nidanas are there in Netra Roga. In Uttara Tantra, Shushruta explains. So all these things should be avoided by the patient. And Haita Bhojana, I should not take any foods. And Dashavida Papa Karmas, Himsaste Anyata Kamam, Paishunyam, Parushamandritam. So all these things should be avoided by a patient. So we did the Tarpana. For 7 days is the normal procedure. For 5 days also we can plan for the Tarpana. So think how we have to confine that this Tarpana is did very well to a patient and whether it is given good result or not. So for that, our acharyas, they have mentioned very nicely that Samyak Tarpita Lakshana. Samyak means if you are doing the Tarpana in a proper way, so we'll get the patient symptoms from the patient. See, Sukha Swapna. Sukha Swapna means patient will get the good sleep. Patient will tell, so have got a good sleep, ma'am. So Avabodhatvam, blissful awakening. When he go to the sleep and he will automatically will wake up in the early morning. So we have told that patient, we should not tell the patient to awake at night. So if he is sleeping at a proper time means he will automatically awake at an early morning. And Vaishadhyam, clearness of an eyes. Patient will get clarity of vision and discernment of individual colors. So patient Varna Patatvam means patient can tell, this one is green color, so this is white color, this is black color. He can easily differentiate the colors. Before that, patient may have any different difficulties in identifying the colors. In such a conditions, we'll get all these symptoms. So Sukha Sapna Bodhatvam Vaishadhyam Varna Patavam. So these are the Samyak Lakshanas for the Samyak Tarpita procedure. Nivrutti, along with that feeling of comfort. Nivrutti means that the term itself indicates Nivrutti. Rutti means the patient feels comfort, which is the difficulty was there before to this procedure. Afterwards, automatically you'll get comfort. Vyadhi Vidvamsa means cure of disease. Vyadhi Vidvamsa, that is going to burst out the Vyadhi. And Kriya Lagavam, he will very easily close and open the eyes. He will get very easy in closing and opening of his eyes. And Prakasha Kshamata, ability to withstand bright light. So Prakasha Kshamata means normally we cannot see the sunlight. But after doing this procedure, patient can see the sunlight directly. Coming to the Hina Tarpita Lakshana. See, if you did the procedure of Hina Tarpana, so the patient will experience these symptoms. See, Netra Rukshata. You cannot tell that the patient is telling dryness. Patient will tell, I am having the dryness of eyes. And Avila, indistinct vision, Avila Darshana, either it may take as blurred vision also. Ashrusrava, lacrimation will be there if you are doing improper. And Asayam, Rupa Darshanam, Asahyam means difficulty in vision. Patient can't persist the vision. And Vyadhi Ruddhi. What here they have mentioned Vyadhi Vidvamsa. If you are doing improper means Vyadhi Ruddhi. That will be become a step to increase the Roga. So aggravation of doshas will occur that will cause the Roga. And Ati Tarpita Lakshana. If you are doing this procedure for more than 7 days or continuous without the planning of the Dharana Kala Sneha, so what will experience? Patient will tell Netra Gaurava means heaviness in his eyes. He is getting that feel of heaviness. And Avila, indistinct vision. Ati Snigdata. So we are pouring the medicated ghee. So Snigdata will become more. In such a condition, excessive oiliness patient will feel and Ashrusrava, lacrimation will be there and Kandu, itching, Upadeha, stickiness. So for that procedure only they have mentioned in normally after the Tarpana we should go for the Nastya. And Dhumapana. Dhumapana is mainly for Kafagna, Kafara. Here we are doing exhaust means it will increase the Kafacha Lakshana such as Kandu, Upadeha, Ashrusrava and all. Treatment of inadequate and excessive Tarpana. So if the patient is tell that, so Ina Tarpana and Ati Tarpana you have read means you are having the medicines for this also. See, you can further proceed for Dhumapana, Nastya, Anjana, Seka, either Ruksha, Snigdha are to be done for treating both inadequate and excessive Tarpana conditions according to the predominance of doshas. Snigdha Seka. Think that if the patient is still having the Vata predominance, Vata is going to provoke more means we plan for Snigdha Sneka. And Ruksha and Kapha dosha and Shita Seka and Pitta dosha. According to the dosha, we have to plan for the medicines as well as the dravya. So there are so many formulations we are using for Tarpana, that is normally Trifala Gritha and Mahatrifala Gritha, Patoladi Gritha, Jivantyadi Gritha, etc. So many Grithas are there to treat this. Chakshugruta in our college they have invented, in that they are getting very good results also. Trifala along with Jivanti is there in this Chakshugruta. Thank you all.
We have a question here.
I had a few questions. Is retinal thinning a contraindication for doing Netra Tarpan?
Yes, sir. So Netra Tarpana is mainly going to give a procedure in such a conditions as anterior segment disorders. So retina comes in the posterior segment. If you are planning for this Tarpana means it won't give that results in that condition, sir. Because this medicine up to that level it is difficult to enter it, sir.
And is there also a possibility that the retina further gets damaged if it is done? So to what grave extent is the contraindication? I think Vikram sir also probably meaning to ask this.
Sir, we can plan, sir, but in that conditions, retina, because the contact duration of the medicine, we are pouring up to the 1000 matra kala, minimum 15 minutes, we are keeping that Gritha. But up to the level of retina, if it is reaching that medicine means, the medicine should be reach up to that level, sir. Because we after half an hour we'll tell the patient to get away from that procedure and all. So to reach the retina, whether we have to increase the duration of the procedure, sir, then it may give result.
But what about in thinning, as Vikram sir was asking?
No, sir, definitely we should not do that process, sir, because already retina is thinning means if you are pouring there is a gravity for the medicine, sir. Ghee, it is having the lipophilic activity and it is having liquid in state. If you are pouring the liquid over a thinning material means definitely it is going to break. Either the layer may get damaged, sir.
You mean to tell due to the pressure, of the therapy, it can impart more pressure on the retina and further bad consequences. Yeah, damage and bad consequences can happen. So it's better to take a caution and not to take the case for Netra Tarpana. Am I right?
Yes, sir, definitely, sir, because the patients are very much cautious about their eyes, sir. If you are damaging means they will spoil entire means they will tell and Tarpana it's did like this for us. We can't take the risk also. That is a delicate structure eye, sir. So for that reason I have mentioned.
Is there any alternative in the sense, are there any at-home procedures like application of ghee, which would not impart much pressure but benefit the client in any way?
Definitely, sir. There are wonderful treatment modalities are there in our Ayurveda. In first my episode, what I mentioned Anjana. Anjana, it is mainly for posterior segment disorders, sir. I have mentioned in that also. So we can apply the Anjana because the duration, contact duration of this medicine is also more than half an hour, sir. We can tell the patient if they are applying morning 7 o'clock means up to the 11 o'clock they can give the medicine contact to the eyelids so that the medicine can penetrate and reach up to the level of retina. So based on their disease condition as well as the Roga and Rogi and Rutu, we have to plan and give this Anjana for a patient, sir.
Okay, so that means to tell Dr. Bhavya, so indications, contraindications are very important, like any other treatments, as we have discussed in the previous session itself. Among all the senses and sense organs, eye is the most important one. Sarvendriyanam, as we tell. It is we need to take really extra caution while handling the eye in comparison to the other indriyas. So because it is one thing is delicate and another thing is all our activities are dependent on vision. So here the classification of indications and contraindications, we can also take it as those who fit into the therapy and those who misfit into the therapy should be strictly taken into concern. What kind of challenges did you face in your practice while in inclusion and exclusion criteria while doing Tarpan?
Yes, sir, definitely, sir. While selecting the patient, that we have Acharya they have mentioned that the Yogyavan and Ayogya patients, we should not go for the Tarpana. In that conditions, it's very difficult without the instruments. So we have to take the support of autorefractometer to assess the blood vision. Snellen chart is there. Through that objective parameters, we can plan for the Tarpana. Before that, we should investigate patient conditions, sir, how they are taking the medicines, what is the Ahara Viharas they are taking, what is their daily routine. Everything we have to plan. Based on that only we can proceed for the Tarpana, sir. Tarpana is not like that one day procedure the patient can take and go. It is like 5 days and 7 days. We have to convince the patient to stay with us. If they are coming from home means it won't give that much good results, sir. The patient should be there in our under, means IPD should be there. So for that condition, patient should not expose her to the bright light and all. If he is going outside means we doesn't know that what the patient is going to follow. In such a conditions, it won't give good results, sir. But what are the patients in our IPD? They will tell, sir, patient itself, they tell that after the Tarpana, I'm very comfort with my vision and I can see the sunlight also. Like that they will tell. Even by seeing their mobile screen also, they will tell that continuous watering of eyes are there and I can't sit in front of the lab while engineers, they will complain that I can't do more than 6 hours. Like that they will complain, sir.
And some people will also have the patients will also have certain possibilities and impossibilities which they need to look into. Like if somebody asks for a therapy to be done on a OPD basis, like you said, the patient being inpatient is always better so that we can constantly monitor the patient, the therapy, the effect of the therapy and all those things. And when we discharge on a daily basis, we are not sure whether the patient is following the instructions or not. But anyhow, we are going to discharge the patient after 7 to 10 days, whatever the therapy range is there. And even after that, we will not have the surety. So there, the self-acceptance of the patient that they need to do, the do's and don'ts, they need to focus even after the discharge. That also becomes important. But the real challenge is if the patient really asks for the outpatient approach, like we cannot get admitted here. In that case, some special arrangements need to be done or some special precautions need to be done. Would you allow it or would you not allow? So that is one basic question.
Sir, we may allow, sir, but it depends on patients, sir. Because nowadays we know that patients will tell Ayurveda won't give a good result. But in our Acharya, Charaka and Sushrita, they have mentioned what is the rules and what are the regulations to do this procedure and to take means they are having their own preference and they are giving by following those rules only will get a good result and patient will also cure, sir. Because of the patient priority, if you are following means the disease either it may not cure or the patient may doesn't get a good result and they will complain that so this won't give the good result for us. In such a condition, better we have to avoid that patient itself, sir. because our science is eternal. We cannot change the rules what the acharyas have mentioned. We have to get the result means we should follow the rules, sir.
Like, can Netra Tarpana done? Can it be done after cataract surgery? What are your thoughts on this?
Immediately after the cataract surgery, immediately we should not do, sir, because we have implanted a lens. In that cases, the eye should be get the consistency, because ciliary muscle, it should be capable of holding that lens inside. After because we are pouring the ghee over the eyelid, we'll tell the patient to close and open the eyelids while doing the procedure. If the gravity of the medicine, it may increase it. Either the patient is structure ciliary muscle is delicate means it may displace the lens. So such conditions we should not do the tarpana. After the some of the 6 months duration, after 6 months of this post-operative surgery, we can plan for the tarpana to give the strength for the ciliary muscles, sir. That's good, sir.
So minimum window period of around 6 to 8 months we need to live before doing any tarpana for a patient who has undergone cataract surgery.
I was wondering which ghee would help with, which Gritham would help with reduce cataract for a senior client who's not undergone cataract surgery, who's not looking to go to cataract surgery, but wants to use Netra Tarpanam as a means to help with the developing cataract in the eye.
Yes, sir. Definitely it was there, sir. They will explain, our acharyas, they will mention one chapter for it, sir. That is Kafaja Linganasha. They have mentioned cataract, named it as Kafaja Linganasha. To preventing this cataract, they have given so many Anjanas and Tarpana for it, sir. Means Anjanas, how many they have mentioned means by using the peacock feather, Anjana should be made out of it, and that should be applied as a regular once in a week. They have mentioned once in a week we should apply that Anjana so that we can prevent through this cataract. That means mature of this cortex and all. We can prevent a cataract as a mature stage, sir, if it is visible in such a condition as immature cataract and all.
And the second question was related to the time at which it is to be done. I believe you mentioned it's recommended in the afternoon. The main purpose is to protect the eyes after the procedure, and the timing is determined more in relation to protecting the eyes rather than the actual time itself? Or is there something related to the time of the day also in recommending the time at which the procedure is to be done?
Yes, sir. This procedure, Anjana, should be done in the morning as well as in the evening, sir. Because Ritu, we cannot change it, sir. We should not go this procedure when the sun is high level. That means in the afternoon time, we should not prefer this Anjana. Other than this, we can apply the Anjana except the cloudy weather and in when the sun is at high. Means afternoon. These two conditions are whatever the procedure and whatever the times, it doesn't matter, sir. In these two conditions, we should avoid the Anjana, sir. Netra Tarpana, we can go for, that should be done in the afternoon itself, sir. Because Tarpana, the liquid which is we are pouring, that is having the Shita Guna, sir. So for to contract that Ushna, we have to go this Shita by using this medicine at the exact time of Ushna, sir, when the sun is at high level. That means afternoon, sir.
What about in Vata disorders, especially for somebody in the Vata stage of life?
So for that reason, when the doshas are coming out, sir, that is Vata means evening time. Evening time we have to do this Tarpana, sir. Especially within 6. Within 6 we have to go for this Vataja. That means Tarpana in Vata predominant. If it is a Pitta predominant, we can do this Tarpana at Pittaja Kala. That means afternoon, exact 1 to 2, sir.
What would be the preference, like in cataract, Kafajalinga Nasha you also mentioned? Would it be mandatory to go with an Anjana and then to be followed by Tarpana?
Yes, sir. Definitely we can plan, sir.
No, can be planned or should be planned. So that is the question. Like, is Anjana mandatory before doing, like, would you expect some Lekana Karma, something to be done before doing the Tarpana, or is it obligatory? Like, according to the situation and also the condition, we can make it worse.
According to the condition also we can make it lesser. In case of Balasa Gratita, means in that conditions we can do the apply the Anjana. Anjana, it will wash out itself the whatever the bacterial growth was there, that is going to remove by this Anjana itself. So after that procedure, like as we take it as a Anjana, we did like as a Lekana Karma. Then we are doing the Tarpana means, so the medicine will automatically get a path to observe itself, sir.
But the question is, should it be done as a rule, like as a Puro Karma for Netra Tarpana, or need not? in cataract?
No, sir. In cataract, no need to do that, sir. Better avoiding the Tarpana, you can go for Anjana as a pre-op and as well as post-op, sir. Immediately after the cataract, they can apply the Anjana, sir. If the
So when
patient is discharged from OT.
When it comes to cataract, Anjana is a preferred therapy rather than Netra Tarpana.
Yes, sir. Anjana is preferred one, sir.
And you also mentioned regarding it being used in the afternoon. Like, are we looking for a more coolant effect of Gritha or Gritha Manda or the medicine which we are using in the afternoon? And what if we start some therapy and some seasonal variations, due to some seasonal variations, if suddenly it gets cloudy on a particular day and there is no sunshine or brightness in the afternoon, no heat at all. So Durdina, as you already mentioned, should we discontinue and begin start right from the beginning, or how to continue the procedure with a break?
Okay, sir. For example, sir, I have given a patient for up to 3 days Netra Tarpana. In the next day, on 4th day, if the weather is cloudy and it's full of rain, means we should avoid that only on that day. And next day, we can continue as the 4th day. If the gap is more than 3 days, means we have to continue from first onwards, sir. Only 1 or 2 days, we can continue it as the same procedure continuation, sir.
Still, after giving a break and you need to restart, in between that, you will go with the same Paschat Karma for us, like Dhumapana and everything?
Yes, sir. Definitely, sir. Dhumapana is there, sir.
Okay, so that we need to do and continue the therapy right from the beginning.
Yes, sir.
What difficulties did you face in your clinical practice, Dr. Bhavya? Like, see, you said the patient should keep on blinking the eyes. That makes logic. So because the medicine has to come into contact with the eye, and how difficult it is to convince, because people will be scared to open their eyes when you are pouring the Gritha, so that looks a scary picture. Do you show the pictures before that and give a demo? Like we will do the therapy. So because the procedure need to be explained in detail, how much counseling it takes into making the patient agree that such a therapy will be done and some medicine will be pulled around your eye and you need to keep on blinking your eyes. So just by the thought itself, many people will get a scare how to open the eyes and close the eyes. Question number 1. Related question is, how do you convince people to go for a Dhumapana? So like a woman or a girl, or even some people who are not used to this Dhumapana, suddenly they may feel like there is also some religious and also beliefs related to that. So there may be many stigmas. How do you handle these two conditions?
Coming to the first point, sir, we have to convince the patient. If they agree, means first we have to show the photos. In our OPD, there are Netra Tarpana pictures are there. First procedure 1, 2, 3. That means first we are making the masha floor around the eyelids, pali, and coming to the next picture is showing that Gritha we are pouring, and third one is opening of eyelids around the pali. So patient will tell that first 2 they will agree, sir. Coming to the third picture, they will fear that how we have to open my eyes. So we have to convince the patient. I have seen so many videos for the patients, sir. See, this is the procedure we are doing. So these are the patients who have taken this procedure and they won't feel any pain and all. So the medicine should be Gritha Manda, sir, the supernated portion of that Gritha, and it should not be completely Gritha. If you are taking ghee, means it will be having more means heaviness, and Gritha Manda is lighter than ghee. So for that condition, patient will fail. First 2 times they will fear to open their eyelids, sir, while doing the procedure. After the agreeing of them, while doing the procedure, they will think fear, ma'am, how can I open? Na kan bidak agtilla, namig tumba pain agutte, baya agtide. They will tell like this, sir. Once they open the slowly, they will open the eyelids, means automatically the medicine will get contact. They will reach in, the medicine will get entry. So they won't feel any burning sensation and also they will feel complete relief. I will feel tiredness because after 15 minutes also they will tell that, madam, after 10 minutes madre, I am getting relief from this. Like that they will tell, sir.
Like it is a matter of practice to the patient also. Like 1 day, 2 days, they'll get trained into the procedure and then they'll start feeling comfortable.
Yes, sir.
So how do you even collect that Gritha Manda?
Sir, I have taken Gritha, we have to prepare it, sir. After preparing it, we have to keep as it is for 1 day night, sir. 1 day night, automatically, next day, the supernated portion will come up, sir. That should be from cow's ghee only. Then it will give the Gritha Manda. Otherwise, in a normal dairy milk or we are preparing this butter and we are taking the ghee, means it won't give the Gritha Manda, sir.
So like if we have a prepared like preparation, if you are using some Triphala Gritha, for example, Gritha is available, Manda is not available. So do you heat it and leave it for certain time till the Manda is collected and separated?
Yes, sir. Definitely, we have to do like that only, sir. The Triphala Gritha, we have to keep it one day prior itself only. Then the boil, it should be boiled, sir, and it should be kept overnight. Morning, it will get a supernated portion. Every day, we'll get it from that, sir. We have to boil it, sir.
Namaste, doctor. After removing the Gritha, after stipulated time, after removing the Gritha, what should be the time gap for washing the eyes with lukewarm? After how much time do you wash it immediately or give some gap and wash it, and reasons for the same?
Sir, after removing that Gritha and Pali, immediately we should not tell the patient to wash with the water. So what we have to do means, when you take a cotton cloth, we should be dipped in a warm water. That should be kept as a smooth purpose. We have to massage over the eyelids as well as the surrounding where we have constructed the Pali. And superiorly, just we have to clean that area, sir. After an half an hour, the patient is not feeling the comfortness. That means if Gritha they have poured, I am getting irritated by this. As for the cosmetic purpose, they can wash it after half an hour, sir, with lukewarm water.
Immediate washing is contraindicated because it might not give relief, or you want to give a relaxation time to the patient so that the eyes settle down, and then we will wash it.
Yes, sir, for relaxation purpose, sir. And immediately you are pouring the lukewarm water means the medicine which is penetrating deeper, it will stop itself, sir.
So you want to give the time for the medicine to act and then wash it.
Yes, sir.
Like, doctor, how complications with the Tarpana are handled? Example with the Ati Tarpana. How do you handle? Suppose you come to know that Ati Tarpana symptoms are there. So how immediately to handle that?
Okay, sir. If the patient is telling that I am getting a heaviness of my head, heaviness of eyes, they will tell that headache is there. I am getting a heaviness, irritation, kandu, itching of eyelids. So in that condition, automatically, suddenly we should remove the Pali and Gritha. The entire process should be stopped itself, sir, because it indicates it is an Ati Tarpita Lakshana.
Okay, so generally, will you keep a timer to see that we don't go to Ati Tarpana Lakshanas or Ati Tripta Lakshanas? Do you keep a timer to start and stop watch like?
Yes, sir. Definitely, we have to keep, sir. And while pouring the ghee also for both eyes, simultaneously we have to do, sir. One eye should be doing and another in rest. We should not do like that. Both eyes should be done simultaneously. We have to take the support from Upastata, what I have mentioned, supporters, and we have to make a timer for that, sir.
Like, do you make it mandatory? One eye is having a problem and another eye is a healthy eye through your examination. Would you prefer both eyes shall be handled immaterial of which eye has a problem? Both eyes should be given Tarpana, or the affected part only should be given Tarpana? This question is related to Anjana and other things also.
Okay, sir. If the condition is of severe, if the patient is having right eye balasa gratita or any Anjana Namika and Arjuna, in such conditions, we can give the medicated ghee for the affected eye, sir. And coming to the opposite eye, which is normal, for that plain ghee we have to use, sir. But the process should be continuous for both the eyes while taking the other also, because patient can't tell, we cannot tell the patient to blink only one eye. If it is impossible. So they will blink both eyes. So another eye should also be get nourished while both the process.
I want to add up that the time duration regarding, sir, as already in classical also we mentioned, sir, according to the condition, what is the picture of. And the one question has been asked by Mr. Vikram also, sir. What is the time duration? One matra kala means how much? Regarding that, there is a Unmesha and Nimesha has been mentioned in a classic for one matra kala means blinking of the eyes. Is the time duration you have to calculate, and you have to calculate that 1000 into that how many seconds or in a minute it will take for Unmesha and Nimesha. Maybe 3 seconds. And another told that on that basis you can calculate and keep the time, sir. Maintain our time for doing the Tarpana procedures or any procedures where the matra kala has been explained. And another example has been mentioned in classical literature, that is what we call Kitty, what we call, say, sir, just by how much time it is taken place between pressing the thumb and then a finger, and it should be given a sound. That is the one matra kala time duration. It's a calculated duration during the sessions.
A hearty thanks to Dr. Bhavya for presenting such a beautiful topic. Namaste until we meet for the next time. Do take care, and lot of love from Easy Ayurveda. Namaste.